Let's take a look at tonicity and water movement between the extracellular fluid and the intracellular fluid. We'll start with an isotonic solution. In an isotonic solution, the extracellular fluid has the same solute concentration as the intracellular fluid. Isotonic fluid volume excess is caused by conditions that decrease renal elimination of fluids such as kidney disease or injury, heart failure, and liver failure. These are conditions that hang on to fluids in the body. Isotonic fluid volume deficit can be caused by losses of fluid volume through excessive vomiting, diarrhea, or sweating, or through endocrine disorders or third spacing. In an isotonic solution, water movement into the cell equals water movement out of the cell. Thus, there is no change in cell size. Manifestations of isotonic fluid volume excess relate to increased vascular volume, manifested by a bounding pulse and venous distension, and symptoms of pulmonary edema, such as shortness of breath, crackles, and cough. The increase in vascular volume will also lead to peripheral edema. Manifestations of isotonic fluid volume deficit include signs of vascular dehydration, such as decreased skin turgor, dry mucous membranes, and sunken eyeballs, and signs of decreased vascular volume, such as postural hypertension and a weak and rapid pulse. Now let's look at a hypertonic solution. In a hypertonic solution, the extracellular fluid has a higher solute concentration than the intracellular fluid. Hypertonic conditions are caused by water loss, such as with watery diarrhea, or with too little antidiuretic hormone, such as in diabetes insipidus. Hypertonic conditions can also be caused by decreased water intake, such as with hypodipsia. In a hypertonic solution, water moves out of the cell into the extracellular fluid. This water movement out of the cell leads to cellular dehydration. Manifestations of hypertonic conditions include manifestations of dehydration, such as dry skin, decreased tissue turgor, and elevated body temperature, and manifestations of decreased vascular volume, manifested by tachycardia, a weak and thready pulse, and hypotension that may progress to vascular collapse. Finally, let's take a look at a hypotonic solution. In a hypotonic solution, the extracellular fluid has a lower solute concentration than the intracellular fluid. Hypotonic conditions are caused by excesses of water due to excess antidiuretic hormone, such as with syndrome of antidiuretic hormone, or SIADH, by chronic conditions that increase extracellular fluid volume, such as advanced heart failure, liver failure, and renal failure, or through conditions that cause an osmotic shift of water from the intracellular fluid to the extracellular fluid, such as hyperglycemia. In a hypotonic solution, water moves from the extracellular space into the cell. This water movement into the cell leads to cellular swelling. Manifestations of a hypotonic condition include those of central nervous system depression, such as seizures, lethargy, stupor, and coma, and muscular manifestations, such as muscle cramps and weaknesses, and decreased tendon reflexes.